Hi everybody, I'm Dr. Stuart Lutton, founder of the New Life Teeth Clinics UK and Ireland. So today we're going to address two types of dental material available in implant dentistry. First of all, we have zirconia, and secondly, we have PMMA. Now, zirconia is a white ceramic derived from zirconium. That's a transitional metal that sits below titanium in the periodic table. Outside dentistry, zirconia is mainly used for things like cutting tools, so for example, drill bits. PMMA, polymethyl methacrylate, otherwise known as acrylic, is a plastic derivative used outside dentistry mainly in things like the construction of perspex glass. Now, both these materials have distinct differences in their characteristics and performances. We at New Life Teeth use both materials for a full arch jaw rehabilitation and have applied what we call evidence-based dentistry in our decision making here. Evidence-based dentistry is a concept agreed in the 1990s to allow formulation of the best clinical practice based on the most up-to-date scientific evidence and clinical experiences. Now we should talk about the cycle of full jaw implant rehabilitation, whereby we insert titanium implants into the bone and attach teeth in what we call an arch. So when is it appropriate to apply the correct material for this arch? First, let's talk about the forces of mastication, or chewing forces. The masseter muscle is the primary muscle used for chewing, and it's well documented that this muscle generates more force than any muscle in the human body. In fact, on average, it can apply 1.5 megapascals of pressure on a tooth. That's a lot of force. Therefore, it's no surprise to note that tooth enamel and dentine are the hardest materials in the human body, with a fracture toughness of approximately 3 megapascals. It's extremely important to control these chewing forces during dental implant treatments. Therefore, we break this treatment down into two stages. Stage 1 we call the surgical and same-day prototype arch phase. This has a duration of up to 3 months until integration of the implants. At this stage, the implants are going through their osseointegration process, where they're gradually fused to the bone. So we want to avoid excessive bite forces during this phase, as what we call micro movements can inhibit true osseointegration. If this happens, the implants will not fuse to the bone. Definitive permanent phase, stage 2. This is delivered after osseointegration and usually around 3 months after the surgical phase. So in stage 1, we use PMMA material, and we use this for what we call our prototype arch, our temporary teeth. And we use it for the following reasons. PMMA is very quick to manufacture. All is done by the milling machine sitting behind me here. PMMA has a low flexural strength, approximately 100 megapascals, so it can bend and flex, and this can help initially on the day of the surgery, as it's easy to adjust and customize into the individual's mouth. PMMA also has a low fracture toughness, approximately 1.5 megapascals. That's half that of natural teeth. So this again allows us to identify if the patient is chewing excessively. We can see any worn areas in the teeth, any chips, any fractures are easily identified. We can of course quickly repair these, but it's more important for us to reinforce with the patient that the chewing force is needed to be reduced and controlled at this stage. In stage 2, we use zirconia as our definitive permanent arch, and we use it for the following reasons. Zirconia has the highest fracture toughness of any dental material. It shows a fracture toughness of up to 20 megapascals. That's 4 times natural teeth. Zirconia is also the most biocompatible material available to man. This means that the tissues inside the mouth show no inflammation in contact. The tissue likes this microscopic smooth surface, as no bacteria can attach to it and survive. Zirconia also has a glass-like finish, so it has the same wear coefficient as enamel, and you don't damage your opposing teeth. They glide over each other with minimal resistance. Zirconia is partly milled in these machines behind me as well, but then it's handcrafted and finished by specially trained dental technicians. This is what we call handcrafted beauty with soul. There are no two versions alike, just as unique as you are. The bespoke piece of craftsmanship can be detailed and match the natural beauty, charm and character that we all seek. For this reason, it takes time and it's expensive to produce, but nothing can match the look of zirconia, so at New Life Teeth we do not compromise. Zirconia also has what we call the highest flexural strength in any dental material, approximately 1200 megapascals. This is the material's ability to resist bending, which in my opinion is the best feature in full arch implant dentistry. The implants in the jaw are positioned from one side to the other, and then they're what we call splinted together by this arch of teeth. If you apply basic engineering principles here to spread these forces, the more rigid that material, the more these forces are spread across the arch, and the better the spread of forces. Therefore, less stress on the implants. Zirconia with this rigidity and its high flexural strength does not bend. So even when biting on one side, these forces are spread across the jaw, and the bite forces are what we say dissipated evenly. This is why we see minimal bone loss and no stress fractures on our implants. So in summary, if you apply the evidence gathered over the last 40 years and you want to avoid complications, then there is only one material that fits the requirements for full arch rehabilitation, and that's zirconia. We at New Life Teeth have over 12 years evidence to back this up. Zirconia has 10 times the fracture and flexural toughness compared to PMMA, 5 times that of natural teeth. Therefore, nothing else compares in strength and durability. Then additionally, you have the zirconia's biocompatibility and the appearance properties second to none. Granted, it's an expensive material and requires the highest skilled technicians to hone and craft it. However, we have mastered that at New Life Teeth, and that's why we promise in our delivery to offer a beautiful smile that's built to last. Thank you very much.